Hi, I'm Abby Kwasnick, and I'm the Pharmacy Clinical Manager here at Providence and Everett. I've been here for the last 5 years, and I've worked all of the clinical shifts throughout the hospitals, and have recently come into this role as the Pharmacy Manager. So hopefully I can provide you some tips and tricks regarding your medication administrations up on the floor. Over the next 40 minutes, I'll hopefully provide an adequate overview of a couple key points regarding medication administration here at Providence and Everett. First, how do medications get to you? Narcotic control, medication handling, medication reconciliation, patient-owned medications, medication safety, and some general pointers regarding medication use processes. In general, our pharmacy department processes over 5,000 orders a day. We now have a new pharmacy in the center of the C wing in the transfer corridor between the D and the A towers. We really enjoy this new space, being more accessible to the patient care areas. Max, there are 11 to 12 pharmacists on a given day shift, and 10 technicians between both of the campuses here at Colby and Pacific. Our pharmacy department now covers 24-hour service in the emergency department. We also provide services on all of the patient care floors, in the OR, and at the pavilion. However, on the night shift, we whittle down to about 3 technicians and 3 pharmacists between both campuses. There are 4 basic medication sources, and this is probably one of the most frustrating parts to finding medications because there are a couple different locations where you can find them. The first and most common place that you'll find your medications is in the Pyxis. There are 3 Pyxises on each wing of the D wing, and there's 2 Pyxis machines in each patient care unit and floor on the A wing. Another location that you'll find medications is the pharmacy supplied stock. Also in the distribution supplied floor stock, and there will be medications coming from the main pharmacy. So if you open up your EMR in Epic and open up the MAR, under each medication there'll be a dispense location on the far right side of your screen. Highlighted here, the first medication listed, it says dispense medication D8 Pyxis. The second medication, the dispense location is the main pharmacy. The third medication, the dispense location is floor stock. And the fourth medication, the dispense location is Colby RX supplied stock. So all of these locations will indicate where you will find your medication and where that medication is coming from. So when the dispense location indicates a Pyxis machine, this is where you'll find the given medication. Typically, these are tablets and scheduled doses. Most of our Pyxis machines on patient care areas are profiled, requiring you to access the patient in the Pyxis first before selecting the medication that you are going to remove. In OR areas, endo, imaging, these Pyxis stations do not require you to first log into a patient's profile, but you're able to remove the medications without this access to the patient. These medications aren't removed patient specific and then are later documented in the procedural area. Most Pyxis machines require an order before accessing the medication. There are certain override medication lists that a nurse is able to override without an order in case of an emergency. This list of medications is located on the pharmacy SharePoint site and is specific to each patient care area based on the emergent needs of that area. In general, the Pyxis is assigned to the patients on the given floor. However, with our new Pyxis ES machines, you are able to access any patient that's in the hospital at any of the machines. So if you are on the 6th floor on 6th South, you're able to go to 7 South and still access that patient and the medications from that Pyxis. This is especially helpful if medications are maybe not loaded in your given Pyxis, but the Pyxis is indicating that you should go to a different machine where that medication is located. If your medication is grayed out in the Pyxis, click to find out the reason why. This is really helpful when you contact pharmacy to resolve the reason why it's grayed out. When you click on this, if RX to load shows up in the bubble as the reason why it's not located in your Pyxis, message the pharmacy for the first dose, and the rest of the dose will be loaded into the Pyxis later. Here's a screenshot. In this case, the nasal spray is grayed out and you're unable to select it. It has a little exclamation point by it. So if you click on it, it says out of stock. Then if you click find more, you can locate the Pyxis machines where this medication is loaded. In this case, it's loaded in the ER in 6E and 6W. When the dispense location indicates main pharmacy, as indicated by this bulk product of meconiazole powder, this is typically inhalers, bulk products, IV medications that all will require a patient name on the label to be dispensed up to the floor. An IV medication, when they're scheduled or at a fixed rate, will auto print the labels and will fill these and get them to the floor, and they'll be located in either your patient bin area or in your refrigerator. A medication that is titrated, so oppressor, sedation medications typically used in the ICU, a medication message must be sent in order to get this refilled. We typically request a 1-hour lead time in order to prepare the medication and get it to the floor in a timely manner. You can find these in the room bin, like I said, or in the refrigerator. Multi-dose containers such as inhalers or topicals or eye drops, these are filled once unless you request them again. In most cases, these are located, once they're dispensed and brought into the room, you'll put them into the patient's locked box in the patient room. Once on each floor, they will let you know what the code number for these lock boxes are, and once they're taken into the patient room, they should stay in these boxes. It's slightly different if you are on units over in the Pacific campus, in 2 North, or in patient rehab. This process is slightly different because those rooms do not have these clear lockbox bins. When a dispense location reads distribution floor stock, this typically is referring to any kind of fluids. These will be stacked up in the med rooms on each unit, and typically are NS with 20 of K, NS with D5. These will all be located again in your med room. A few other OTC items are standard stock in the clean utility room also. When the dispense location reads Colby RX supplied stock, this typically refers to any kind of emergent medications such as dextrose or bicarb or epi, and these are kept sometimes on the shelf above the Pyxis in the med room. And sometimes large bulk products such as nebulizers or IV flagyl, for example, are all stocked above the Pyxis machine and aren't locked up in any particular med dispensing device. In general, be patient. There are quite a few orders coming through at a given time in the pharmacy verification queue. So once the doctor orders it, we allow 15 minutes for stat orders, 30 minutes for a now order, and 2 hours for routine orders. So from the time the pharmacy receives this order, they need this amount of time to verify the order and prepare it in order to get it up to the floor. Depending on the unit that you will staff, You'll be more intimately involved in communicating with your pharmacist, but do be aware that when the pharmacist is responding to a code or certain ED or ICU issues in patient rooms, that the pharmacist may take a little longer to verify your orders. Keep in mind that a pharmacist is looking at the verification queue at all hours of the day in some location of the hospital, so your orders aren't just sitting there waiting to be verified. If you do in fact have a urgent or emergent order and you know your pharmacist is preoccupied in a patient room, don't hesitate to message the pharmacy or call if you need your order to be released now. However, if your order is a routine order, just have some patience and wait until your pharmacist returns and let them know that your order needs to be processed, and they'll get to it as soon as they get back to their desk. The last thing we want you to do is call, because if you start calling your floor pharmacist and you know that they're busy, then that's just one more distraction that they have to pick up their phone and talk to you about maybe a routine order. So please just message from your MAR so that the pharmacist down in the central pharmacy can process your order and get it up to you as soon as they can. So where is my med? We find meds in a lot of very random places throughout the hospital. The tube system is both a blessing and a curse because it gets you meds as soon as you need them, so we can tube them straight up to the floors. However, in some ways they're a curse because if somebody besides yourself grabs the tube as it arrives to the patient care floor, sometimes it ends in somebody's pocket, it ends up at the huck station, sometimes they think they're helping you by delivering it to the med room, sometimes they deliver it to the patient room, and this can be very hard to find the medication. Sometimes if the patient has transferred in the last 24 hours, it's helpful to call back to the unit that they came from. Sometimes that medication is sitting in the refrigerator and it's fastest if you just call the floor, have somebody check if it's there for you and tube it to you, rather than redispensing the dose from the main pharmacy and having us mix it again. The other location is always to check the plastic bin. So below in the picture is a picture of that locked plastic bin that is located in all of the patient rooms. What if you can't find the med? So after an extensive search and making sure you can't find it, when you've checked all of the usual places, don't call the pharmacy for a missing med. Please send a med message via the MAR and include the following information: your name, your phone number, and the tube station that you want the medication sent to. We are looking at this med message queue 24 hours a day and are processing your requests as soon as we get them. So please give us some time. Again, don't call, just send a med message and we'll contact you if we need any additional information. This will always result in a faster service, including in the OR, IR, and the PACU. So narcotic control. So waste. We must document this in Pyxis, so have somebody else co-sign your waste. We place all of our waste of controlled substances, oral solids, liquids, and even patches into the narcotic waste bin. Ideally, this occurs when you remove the medication, but it can also be documented within 2 hours of removal. Please, if you're pulling an IV medication, such as an IV Dilaudid, do not use this dose. It's a single use only. Do not use a dose, put it in your pocket, and then give another dose maybe an hour later and then waste the rest. These are one-time use, so you should give the dose and waste the rest. And then if you need another dose a couple hours later, go back and remove another dose. So it must be witnessed by a second person that's licensed. So this can include another fellow nurse, one of your supervisor, or the pharmacist. And they must be wasted on the unit. In areas that have larger drips, such as the ICU and FMC, where there are epidurals used, we have larger waste containers that can accommodate the larger volumes of narcotics. In the Pyxis, our narcotic control requires a weekly count every Wednesday, and all discrepancies should be resolved the same day and at the end of the shift. So please, if you know that you created a discrepancy or you ended up amidst a discrepancy from somebody prior, please resolve this before the end of the shift so that they don't have to call you at home or check to make sure that you didn't accidentally take something home in your pockets. Additionally, patient-specific medications, so these are usually your sedation medications and narcotics, can be delivered via the tube using a secure code. The recipient must be assigned and return order, so it's a yellow piece of paper that you sign that you receive this on the other end of the tube, and you send it back to the pharmacy. You should not be holding these medications in your pockets, and you should immediately hang them So you shouldn't be requesting these hours ahead of time in anticipation of the current bag running dry. So again, that's about a 1 hour time interval from request to when it should be expected to come to the floor. So our hospital utilizes surveillance software in the background of Epic, and you're responsible for what you remove. And if you remove something for a coworker, such as in an emergency, you can document this comment in the Pyxis. Also, in many units, you'll remove a narcotic, but somebody else will administer it. This can be documented in your MAR as somebody else administering the medication, and will appropriately track your pull from the Pyxis to the actual administration of what happened in the room on your MAR. Of course, report unusual behaviors surrounding narcotics and pain control, and ensure that you log out of the Pyxis every time that you leave the medication room so that somebody isn't logging in behind you. Medication waste. So there's a lot of different types of medication waste containers that are up on the floors. The blue containers are the most common, and almost all of your medications will go into this waste container. You can include sharps in this container too. The exceptions are your narcotics. So for the narcotics on the previous slide, the narcotic waste bin. Chemotherapy and hazardous waste will go in your yellow bins, and the wine drugs, which we'll talk about on the next slide, go in your black bins. IV fluids without medications can go down the drain. And additionally, your inhalers, which we rarely use around here, will be placed in a bag and can be returned to the pharmacy for us to dispose of them appropriately. The black bins, so these are your wine medications, so it's easy to remember. It's just warfarin, insulin, nicotine, and epinephrine. And these are listed on all of the black bins or above the black bins in the waste areas. And these are also notified on your Pyxis or on the medication label and on the MAR if you forget what these are. Hazardous drugs. So it's your responsibility to protect yourself. We have lots of different caution labels that are located on the medications, and caution pop-ups that pop up in the Pyxis to indicate that these medications might be of a reproductive risk, hazardous, or chemotherapy, and typically they're in a yellow label. You're notified of the risk in the Pyxis as you're pulling it out. Please use your PPE that's appropriate for the specific risk. In most cases, it's simply gloves, but when you're pulling chemotherapy and administering chemotherapy, you'd use the appropriate PPE. Hazardous medications, so you should never cut or crush these medications up on the floor. Please notify pharmacy and they can crush or compound this medication and send it up to you so that you can administer them safely. Reproductive risk, in general, you can crush these up on the floor if you are not in the at-risk group. However, RX would be more than happy to, the pharmacy will not compound these, but you can find another one of your fellow coworkers to crush these and administer them to the patient. Chemotherapy, never cut or crush these. We can't even do this in the pharmacy department. So prior to admit meds, you'll get a little bit more training from nursing regarding how to complete a prior to admit medication list. And this is kind of a little joke. So right now I take a blue pill, a purple pill, an orange pill, a white pill, and a yellow pill. I need you to prescribe a green pill to complete my collection. So sometimes patients use their medication list as more of a menu than they do as a absolute list of what they take every day. This makes it very difficult to gather this information from the patients. We do have some technicians up on the floor who provide a consult service to do prior to admit medication reconciliations. However, these services are limited to patients with quite complex and high-risk medication lists prior to their admission. In general, when you're completing a prior to admit medication list, it's a list, it's not an order. So don't be too concerned about the nitpicky idiosyncrasies of medications, especially if they're low-risk medications. If it's Docusate or any kind of general PRN, Tylenol, ibuprofen, it doesn't matter exactly how the patient's taking it. It is what the patient is currently taking, not what they were prescribed. So we want to know what the patient was taking prior to them coming in. If they were only taking one of their 5 medications, then only put the one medication on the patient list. It should indicate the name, dose, frequency, and so please don't just select the first option that pops up. You need to ensure that the dose is confirmed because sometimes this leads to a medication error. So patient-owned medications that they bring into the hospital, in general, they should be put away and sent with the patient's items into the secure safe. However, in some circumstances where their medication is a non-formulary item, we will utilize their medication from home, we'll identify it and put a label on it so that you're able to scan it and administer it. In some cases, these are topical medications and inhalers or high-cost medications that they get from a specialty pharmacy. The provider must order these medications before pharmacy IDs them. And please let pharmacy know when that patient's medication arrives on the unit and put it in the plastic clear container in the patient med room. Sometimes there's concern for charging the patient for oral medications, especially if they're a Medicare outpatient. Our charges are minimal for the patient if they are in this observation status. So please comfort the patient that these pricings, they won't be charged an exuberant amount, and that they should put away their own medications and should not be taking their medications on top of the medications that we are giving them here in the hospital. Additionally, if it's a narcotic medication that is their own that is coming from home that we will use to supply, we need to take that down. The pharmacist will come to the room, count the medication with the nurse and the patient present, and we'll store that in our C2 safe in the pharmacy. Unfortunately, every time the patient needs a dose, you'll have to message the pharmacy and we'll remove it from our safe and dispense it up to the floor for the patient's use. High-risk medications. So there are a few medications such as anticoagulants, thrombolytics, opioids that require a second double check before you start the infusion in the pump. This also includes chemotherapy for those on the oncology floor, and also there are some location restrictions that change from floor to floor regarding the risk of the medication and the nurses that are trained to administer them. Discharge prescriptions are offered as the patient is being discharged from our outpatient pharmacy. This retail pharmacy is located in the lobby by the cafeteria. You can both e-prescribe to this pharmacy and also fax prescriptions. They are open 365 days a year and every day of the week from 7 to 7, Monday through Friday, 9 to 5 on the weekends. So making it all work, here are a couple extra tips and tricks regarding some medication things that that might assist you on your way. And so as you're training up on the floor, please contact the nurse training you or pharmacy, and they can help guide you through the resources that we have within the Providence system to make your life a tad bit easier regarding your medication administrations. So we do subscribe to Micromedics and Up to Date, and both of them have compatibility checks that are located on the main Providence website. If you are unfamiliar with these resources, contact your pharmacist and they'd be happy to show you a couple tips and tricks on how to find your compatibilities easily. Medication timing. So here at Providence and Everett, we have set standard delivery time or delivery administration times to make your life as a nurse easier. We attempt to make your medications due, including all of your IV antibiotics, at set times, typically 9 and 9. However, if it's at Q8 hour or a Q6 hour, it'll set to 9 and 9 and then the interval that's in between. If you are late on a medication administration, please contact pharmacy if you are unsure if this is too late or too early with the next dose. However, we typically do not adjust future administration times based on this unless it's unsafe, because in most cases we want to return back to standard administration times so that it can ease the way of your fellow nurses that are following behind you. In general, we just want to spread out the medications if they get off enough that they are safe for administration to get back on schedule. Again, this is all contextual, so please reach out to your pharmacist if you feel like it's a high-risk medication and the timing needs to be changed. Additionally, allergies, height, weight are really helpful to medication orders. There are a few medications that require a height and weight to be entered into Epic before we can dispense the location. Additionally, when the order is released, it goes into a virtual queue for our pharmacist to look at, and as I mentioned before, there is always multiple pharmacists staring at this queue 24 hours a day. So please, if you are anxious to get your medication or if it's an urgent, please send a medication message or contact your pharmacist, your floor pharmacist. However, if it's non-urgent, please just be patient and the pharmacist will get to it within, typically our average verification time is about 15 to 20 minutes. You have a pharmacist on all of the floors, and there's a number on your floor sheet with all your phone numbers. The distribution, the central pharmacy is a separate number, so please be aware that your pharmacist versus your central pharmacy, that where your medications are being dispensed from, are two separate pharmacies. Pharmacist with two separate phone numbers. So depending on your issue, whether it's a compatibility or a clinical question, those would be questions that would go to your floor pharmacist, versus if you're just missing your medication or need an additional dose because you spiked a bag and it leaked, then that would be your distribution pharmacist. And again, as another reminder, medication drips up in the ICU. Please give about an hour to message for a new bag for us to get that up to you in a timely manner.